Hello, everybody, and welcome to our Spring Fling virtual open house. I am Trish Banks, the patient care coordinator here at Renew Health and Wellness, and my co-host.
I'm Jamie Van Kirk, soon to be McCoy, and I'm a PA here, one of the providers.
Right, and so tonight we have a special program for you. It is going to be a lot of fun. We are going to be giving away a ton of prizes in the form of services here at Renew Health and Wellness, actually over $10,000 worth. So hopefully you'll win. Everybody who signs on tonight, your name is entered somebody is right now writing your names on slips of paper. We'll be bringing those to us, and we're going to draw names tonight.
It's always the most exciting stuff.
It is. Yeah. It's always fun to win. That's right. For sure. And I want to mention, if you do win something tonight, let's say you win weight loss and you're skinny. You go, well, you know what? I don't need to lose weight. Right. So if you don't need that service, or maybe maybe it's not a good service for you, period, you can gift it to someone else, or you can actually use the value of that service towards a different service. So whatever you win is a big win-win.
You're still winning, regardless.
That's right. That's right. So tonight, not only are we going to highlight our services, we're going to have testimonials and before and after pictures.
Those are my favorites. I love the before and afters.
Me too. And we're also going to do great discounts on all of our services. So hopefully you'll find something that you want to jump into, and tonight is the night to do it. So we're very excited to get started, and you right now have $50 in your pocket.
Just for showing up.
Right, just for being here.
That's right.
And if you invited friends, then you have more. You may have 100 or 150.
It's a gift that keeps on giving.
It is. Yeah. It is. So hopefully you're ready to actually watch tonight, and you'll find something that you get excited about and will call us. So this is our phone number. It's going to be up all night when we're live, and we're going to have it on the videos when we're not live. So you'll have plenty of opportunity to jot it down so you can give us a call. So we're happy to be with you this evening.
So true.
And we kind of want to jump right in with our core service. So Renew Health and Wellness, we started out as a bioidentical hormone replacement clinic here in Richmond. And since then, of course, we branched out. We've got all of our locations with us tonight. We have Greenville, South Carolina. We have Nashville, Tennessee. We have Fredericksburg, and of course, Richmond, Virginia. So welcome to everybody. And we're going to talk about hormones because that's how we started. And that is our great.
Well, and we're New Health and Wellness, and it's such a cornerstone to health. So exactly. I'm glad that was our foundation.
Me too. Yeah. Certainly that's what brought me here. So without further ado, let's just jump right into our first testimonial video. We have a wonderful client with us today. This is Melissa. Hi, Melissa.
Hello, how are you?
I'm doing well.
Good.
She is going to talk to us about her experience here at Renew Health and Wellness. And so tell us, how long have you been coming to Renew?
So I have been here at Renew for just over a year. I just renewed to come back for another year. So
Great.
You'll see me again. But it's been about 12 months that I've been coming to Renew.
Okay. And originally when you came in, what brought you in?
Honestly, my husband.
Oh.
Believe it or not.
Okay.
My husband has been doing hormone therapy as well. And he knew that I was struggling a little bit with some anxiety and some hot flashes and just regular perimenopause things that a 48-year-old woman would have. And he suggested that I come in and talk to you guys about how you could help me.
Wonderful. And so in perimenopause, just for those of you who don't know, that's before full menopause. So women here at Renew, we have all different age groups. We have some younger women in perimenopause who are still having a cycle. Sometimes it's even still a regular cycle, but that doesn't mean that their hormones are balanced. So what you find as you head into perimenopause sometimes are things start changing.
Yes.
And some of those changes are maybe some hot flashes creeping in.
Yes, for me it was a lot of trouble sleeping. I had a lot of almost like heart palpitations where you're just having a lovely day and you're walking down the stairs, but yet all of a sudden your heart starts beating really fast and you have to sit down and maybe your emotions overtake you, and general crabbiness.
Right. Right. You know, that's true. That's why husbands do say, here.
That's exactly what my husband told me to come in. He loves me and I love him. And sometimes you just maybe need something to help you get over the hump of whatever it is that you're not in control of. So that's why I came in.
Yeah, a lot of women I find when I talk to them, we have a symptom sheet you fill out when you come in, and they'll fill out the symptom sheet and they've got irritability, anxiety, mood swings, and I'll say, have you always had anxiety? No, you know, it's really just been getting, you know, dramatically increasing.
Yes.
So a lot of doctors, if you went to a regular physician, would say, oh, anxiety. Well, here, let me give you, you know, some Xanax or, you know, something, a prescription drug for that. So I see a lot of, especially perimenopausal women coming in already on antidepressants and anti-anxiety meds. So it's great when you realize that your hormones play such a big role in how you feel emotionally and physically, even, you know, mentally. So depression is another big issue with low hormone levels. So now you came in, you got your hormones back, I guess, up and balanced, I should say.
I did, and that was a question too. I said to him, what if I go in and they say there's nothing wrong? And he says, well, then you went in and they tell you there's nothing wrong. But they're going to give you at least a full workup and you're going to get the answers to your questions.
Absolutely. So we always do lab work, so we can actually see what's going on with your hormones. That and your health history and your symptom sheet all work together, so we know, you know, exactly what you need to get you back up. So now you've had a year in.
I have.
And how have things changed for you?
I think pretty much immediately, I definitely noticed an increase in energy. I was getting a lot of those mid-afternoon slumps where I was feeling quite tired and I was kind of run down and I was like, why do I need a nap? I don't know, you know, why I was wanting more sleep. So immediately by getting the injection and then taking the progesterone, it helped me get a better night's sleep. Like I went to bed and I stayed in my bed and I stayed asleep, which is almost unheard of for me at this point. Going to sleep and staying to sleep and having a good night's sleep was like almost immediate. It did help very quickly regulate my periods and help me get a heavy period under control. So even though I was tracking it and I was still having a regular cycle, it helped me almost like minimize the amount of, you know, things that I was having an overload of before.
Sure.
I did see a difference in sleep right away. I saw a difference in energy right away, and it helped regulate my cycle right away.
Wonderful, wonderful. And the good news with this is that as you go through menopause, you are going to have a much easier transition. So without the hormones being on board, the symptoms that you start to experience in perimenopause only increase. You know, women think, well, you get through this, right? Menopause is like an event, they think, right? Well, my period's going to stop and then I'm going to be through with that menopause stuff and I'm going to be fine.
It's not that quick. It's not that fast.
No. It can last years. I hate to say it, but it certainly can last years. And even once your period stops and you're fully in menopause, then you can then get slammed with more symptoms. So my story is that I started here post-menopause. I had several years after my cycle stopped to find out how awful I was gonna feel. And so I thought it would get better. It never did. It just continued, you know, down the same path of exhaustion and not sleeping and no sex drive and, you know, just feeling
all the things that make it feel like it's taking even longer.
Exactly.
Even longer.
Exactly. And so whether you're in peri or you're in the middle of menopause or you're post-menopause, wherever you are, getting your hormones balanced is going to make an incredible difference, not only in how you're feeling and in the quality of your life, but in your health as well. So it's very protective. As you know, it's going to protect you from your bone density, so you won't have to worry as you get through this about osteopenia and osteoporosis. Great for the heart, great for brain function. We lose our neurotransmitters when our hormones start to die off, they start to die off. So if you're feeling like I'm foggy brained
Right.
or I can't stay on task, there's a real reason for that. And so getting those hormones up and keeping them up is going to prevent. There's even a study that shows the prevention of dementia and Alzheimer's. So we're protecting ourselves as we age.
Well, they also talked to me about vitamins and extra things that I could be doing along with this treatment to help me feel better. Different vitamins that might help me with energy, vitamins that would help you with sleep, getting kind of like a full, complete care it's nice because you can come in every couple of months and talk to somebody and ask those questions and say, this is what's working, maybe this is not, and then they can help you along the way.
Exactly. We have a terrific medical staff here. Very thorough and extremely, this isn't a place where you come in and you're seeing, like, I think I was reading an article that the average visit with a primary care physician is 8 minutes. You get 8 minutes,
right.
And there's really no way to there's no way to really explain what's going on with someone or really get in depth in 8 minutes. But here at Renew, you get to speak with practitioners. We have incredible, like I mentioned, staff. So they're going to ask you, how are you feeling? They're going to listen to how you're feeling, and they're going to look at your labs. Quite often here, every 3 months at a minimum, we're going to be checking your blood and talking about your results with you and your dosing. So it's a very much of a give and take here, like an interactive relationship.
Yeah, it's very nice to be able to sit down and say, okay, here's where I'm at now. You can look at exactly where you were last time, what they're giving you, how it's affecting you. I've had, great other benefit results from doing this as well. I've actually had new hair growth happen, which is an unexpected result. I didn't know that would happen. So now I have all these little baby hairs coming in around. They might be white, but they're still there. So there is benefits too. The sleeping better, taking the magnesium at night to help you sleep, and taking that progesterone at night to help you sleep. Sleep for me is, I'm a big napper. I love my sleep. If I could say my hobby is sleep, I probably would say my hobby is sleep. So to get a great night's sleep and have that kind of, I don't know, it's like you bank that energy. When you have a great rest, you're a happier person. So.
Absolutely. Sleep is super important. Not only for energy, but for weight control. There's a lot of information coming out now. The reason that many women, especially through menopause, put on weight is they are not sleeping.
Right.
So they never get into that nice deep REM sleep so that their bodies can restore and repair and process fat, right? So, well, anyway, it sounds like you're doing great here at Renew, and we're so happy to have you as part of our family.
Thank you.
So hopefully maybe we'll talk again next year and see how you're doing.
I'll be back. I just signed up for another year, so I will definitely be here for another year. I think that it's important to look at your whole body health, to, like you said, maybe come in and talk to somebody and find the answers rather than, here's a pill or a blanket cure-all at your doctor. Right. So I'm a big believer in that, and I think that it has been a great experience for me. I've really liked it, and I will be back.
Perfect. Well, thank you so much.
You're welcome.
All right.
Thank
you. Okay. Welcome back. So that was a great testimonial. Thank you so much, Melissa, for sharing with us. And we want to mention that tonight we have a wonderful special with our hormone replacement therapy. But before we get into that, we talked on that video, Jamie, about women specifically. But we went through pre, peri, postmenopausal women.
We have so many fun stages.
I know. Some of them aren't fun. But I will tell you, we didn't talk about men.
Oh.
So we want to mention now that men need hormones.
Oh my gosh.
Just as much, if not more, than women. And here,
get started.
Yeah. So here we have a great program for men as well with testosterone replacement therapy.
Yep.
And so if you're a man and you're having the symptoms, a low libido, maybe you have some erectile dysfunction, muscle loss,
energy, the muscle loss.
Yeah. Brain fog, and sleep.
What's funny, the sleep thing was an interesting piece of the puzzle to me, but the number of men that I've heard, once they get their hormones balanced, they're like, oh my gosh, it's the first time I've slept in ages, like sleep
Exactly.
and soundly. And-
Exactly. It's great for energy
Mhm.
too, and motivation, right?
Yeah.
Yeah. So if you're suffering, this works for you as well. And, come on in, get your labs drawn. Let us tell you, where you're at. I will say that our men are very happy here
I know.
as our women.
That's
And we have a lot of couples that come in
That's
here.
my favorite. That's actually my favorite. I like it. They time their inserts like at a similar time.
Right.
Some hormones are like peaking together. It's like on the
Exactly.
same page. Yeah.
We see a lot of marriages really rejuvenated
Yeah.
through hormone replacement
This is
therapy.
true.
Yeah,
Yeah.
bringing it back to life. So tonight we have a great special. So if you can pay for your year in full, it's $500 off tonight.
It's a great discount.
It's a great discount. So it's a great time to call, and you can put a deposit down. You might say, I'm not sure I need hormones. That's okay. Call us, put your deposit down, come on in, and we'll do labs and check,
Mhm.
and we'll do our consults are free. So come on in. If you say, well, I don't know, maybe I have to make payments, that's fine. You still get $350 off tonight.
Huge.
Yes. So pick up the phone. If you're a current client here, and I know we have a ton of them watching. So if you're a current client here, you can also get a discount on your next year's renewal. So let's say, you're in the middle of the year, but you want to take advantage of the special. Call us tonight. We'll check. It's off of the scheduled rate. So depending on what you're paying now will depend on your discount, but you may get a discount. So it's certainly worth calling and finding out and renewing early to take advantage of the special. So pick up the phone, and we also
Wait, do they have to pay early or no? Or
So
do they not
yes.
pay till the next renewal time?
No, they would go to get the special. They do have to do that early.
Got it.
Yeah. I will tell you tonight we have a great grand prize. We are giving away a full year of hormones. Right. So
That's
yeah.
one lucky winner.
one lucky winner there is going to get a full year. And so we'll do that drawing at the end tonight. It's kind of a teaser. But anyway, we'll do that at the end of this evening. But right now, we really want to talk about something else. And that is Jamie's favorite topic of all time.
It is health in general, but one of the most, I don't know, maybe not the most important aspects of health, but certainly one that has such a bearing on so many aspects of life is sexual wellness. And it is one of my favorites, not just for me, for the joys that I see come into our patients here, but for my personal experience with the sexual rejuvenation services that we offer, it's been life-changing for me. So one of the ones that we offer in all our locations, sometimes it goes by a different name, sometimes it's Votiva, sometimes it's Viora, and some of our other locations, but both utilize radio frequency. And so let's say you're a woman, I don't know, that's had 3 children and maybe is having some urinary incontinence. I would always joke, I can run without peeing, I can laugh without peeing, but I cannot simultaneously. Well, now I can, but I couldn't before.
Right.
Before using these services here. So the radio frequency really does a lot to rejuvenate the entire vaginal area, whether we're talking labia that over time lose plumpness, or internally. When I worked in OB-GYN, and you'd see women that were postmenopausal, and that tissue just gets so thin and so dry, and Votiva really addresses that as well.
It does. Yeah, it's a wonderful therapy. So, it's incontinence, it's laxity, it's appearance, it is
even sensation.
Exactly.
And that's a biggie for pleasure. Although it's funny because even for our patients here that aren't in relationships, I've had folks that were like, it's actually kind of painful even to use the bathroom and wipe. Just it's so dry. So if you can address that tissue in a safe, painless way, really, it's like what, maybe 30 minutes, and it's like warm. It's just warm. There's nothing.
No downtime.
No downtime, no risk. Like, if you go to a doc and they're using scalpels to change things up,
or they use lasers sometimes, and that's pretty traumatic also.
It can be traumatic to the tissue.
Yeah.
And this just gently heats the tissue and stimulates your body's own fibroblasts, which are super important in stimulating collagen. We think about it for our face, but it's important, you know, in other areas of our body as well.
Exactly. And we have other things, and we're specifically talking about women right now, but we're going to get to the men.
That's true.
But we also, so if this is really, I always think about the radio frequency as kind of restoring youth to the area
This
in
is
all
true.
areas,
This is
like
true.
more flexibility, more contact, more certainly moisture.
Plumpness and
Plumpness,
moisture
yes,
matters.
right,
Yeah.
right. And then I think about the O shot, and I think about orgasms. I mean, I'm just saying. So
That's exactly right. And the O shot, again, that one, the addressing of the urinary incontinence, that was changed almost after, I've done it, what, 3 or 4 times? That tells you right there, it's not painful, even though the idea of it
sounds scary.
it sounds scary to folks. We use really good topical numbing cream and lidocaine, and it's not painful. But truth be told, that the urinary incontinence was
Gone.
gone.
Yep. We have a lot of clients that come in literally every the year
Yep.
for another one, because you know, they'll do a series of 3 and then they'll come back yearly, and you know, and it's great because it's going to just keep them going.
That's
you know,
exactly right.
yeah. So
It's addressing because the aging process doesn't stop.
right.
So therefore, it makes sense that just like you don't do car maintenance on, you know, one time and then anticipate it being over. So and in the same way, if you assume that the body's going to continue to age, then having a yearly time where you come in and say, okay, this is my time where I come in for Votiva or the O shots. And those O shots are using your own platelets. It's the platelet-rich plasma that we use, and we mix it with some calcium chloride, and that causes the rupture of the platelets, which then releases the growth factors. And those growth factors are important for stimulating the regeneration of the tissue and the collagen. And yeah, we've got a lot of patients, and I'm one of them, that are a happy recipient.
We do, absolutely. We also have something here called the FemiWave, and it works in a different way. It uses the acoustic wave therapy, and basically it's going to increase blood flow.
It does.
To the area.
And so if you can stimulate the blood flow to that area, and some of the studies indicated enhances angiogenesis, the formation of the new vessels, which is why we end up using it with our men as well.
Right.
But yes, it's also good for sensation, because a lot of women, just from the aging process or childbirth, that sensation, that decrease in sensation, you know, makes sex maybe less pleasurable.
Oh, it does, definitely. So you don't have to settle. Let's put it that way. So if you're suffering with urinary incontinence, painful intercourse, vaginal dryness, or atrophy, there's a solution here. We have a lot of solutions. So definitely you know, come in and talk to us. We obviously we're very open about
which
it.
One's made.
We have no problem talking about it. So come on in. And we also have some great treatments for men. So Jamie, hit it.
Again, so with the platelet-rich plasma that we were talking about before, that we use with our women's O shots, we do our own PRP shots here.
That's right.
And it's the same thing. It's not a painful procedure. Not topical numbing cream applied. And we kind of talk with you. We find out what your needs are, and we take it from there. But those PRP shots, which are injected using your own platelets, and again, adding that calcium chloride, cause those platelets to rupture within, releasing those growth factors. Does nothing but stimulate the regeneration of the tissue, the collagen. Some guys they'll report not just increased sensation, but even girth, and like they have greater satisfaction, and their partners
do as well.
Concur.
Yes. Very much so. Yes. The other thing that we have is acoustic wave therapy, the Renew Pulse. So we call it FemiWave for women and Pulse for men, or Renew Pulse. And that's using the acoustic wave therapy in the same way to increase blood flow and break up the plaque.
When you think about what's happening with the aging process, and the way we eat, standard American diet, even not the standard American diet, but You do, you get cholesterol buildup within the arteries. And think about what you need to have a good, hard erection and satisfying sex. You need pliability. The radio frequency addresses that. You need to break up the cholesterol plaques within the arteries. And then again, like we were talking about earlier, that angiogenesis. This was discovered, this has been around, actually this technology has been around for a while, because nephrologists were using it. They discovered it when they were doing lithotripsy to break up kidney stones. And what they found was healing of the surrounding tissue. And they were like, and the stimulation of building new blood vessels. And they're like, where else could we use this?
Where do we need blood flow?
That's right.
I know where we do.
Well, they used it in sports injuries, and ED was a natural fit for that one.
Exactly.
So we see guys having great success with it.
Absolutely. And it's natural. You know, you don't have to take Viagra and Cialis the rest of your life. When you can, you know, come in and get it naturally, take you back to your 20s, you know,
For
get
some
your
of the
blood
guys
flow
that were
back.
just like that, and that it allows them to have spontaneity again.
Exactly.
And that's huge.
Yes, absolutely. So tonight we have a special. Yay.
What's our special?
Yes, it's 20% off all of our intimate wellness packages, and that's going to save you up to $800 off tonight. So pick up the phone. You got our phone number. Give us a call. And you know, if you're saying I'm not sure which one's right, you don't have to pick one. Okay.
Yeah.
You just want to make sure and hold that special. So once you call, you'll be put in for a consult, and that way we can determine what's going to be the best fit for you and restore you back to where you want to be.
That's exactly right.
In all areas. Okay.
But it's being worked out.
Oh, okay. Oh, so we may be having a little problem with the phone system. So if you're trying to call right now, don't panic. We're going to be here for a long time. We're going to be, our presentation is about an hour, but we're going to be staying after. And if there's a problem with the phones, we'll get it fixed. Okay. So you won't miss out.
You're not going to miss out on the specials.
No. So don't panic. I'm sorry.
If you saw us have a moment where we were looking like, oh, is everything all right?
I see we had some technical difficulties as well.
Yeah.
That seems to always happen. But you know, that's what happens when you're doing a live show.
That's exactly right.
So,
we
sorry.
roll with it.
That's right. Sorry about that. So now we're going to move on to our next service. So let's see what's coming up next.
It's my lucky day. It's my lucky day. It's my lucky day. My lucky day.
Where's that? I have a special guest with me to talk about her journey through our Clean Start weight loss program. This is Mary Kay.
Then you should do it.
She is on a journey, a big journey, and we brought her in because she's so inspirational. You know, there's a lot of times I think people feel hopeless with their weight loss. Maybe their health is failing.
I felt bad.
They have gotten things are out of control, and they're feeling like, you know what, nothing's going to work for me.
Yeah. Okay.
And even the effort of coming in to lose weight for some people, just the thought of it is overwhelming, and so they don't come in. You know. So today, I want her to tell a little bit about her story. She is doing our Clean Start weight loss program.
We did.
And that is
what we just said.
Wonderful clean eating detox program. It's 12 weeks from start to finish. We call that a round. Some people need to do multiple rounds to achieve their goals. And in the 12 weeks, average weight loss for women is around 30 pounds, and for men around 40. And this weight loss is going to happen in the first phase. So we have 3 phases in this program. The first phase we call VLC, for very low calorie. And so it's pretty short. It's about 43 days from start to finish. And you're going to drop a lot of weight during that phase, usually 4 to 7 pounds a week as you go through that. And then we have 2 phases of maintenance designed to lock in that weight loss. We also do, this is a medical program, so we're going to do initial labs to make sure that you're healthy enough to do the program. We even run follow-up labs if you have any flags on your initial lab after you finish the program, because we want to show you that you're healthier when you finish than when you start. And so it's been very popular. We use a weekly injection that is full of B vitamins and amino acids and lipotropics, so you get a little energy. But the main thing that does is really helps your body process fat. It really helps your liver with those amino acids and lipotropics. So it's been great for our weight loss program. And we also have that as a standalone injection. Many of our hormone clients use it as well. The other nice thing in this program is we use a hormone, and that hormone does a lot of things. It puts you into fat burning mode. You start pulling from your body fat and burning that as fuel. So it helps with hunger. You're not hungry because you're getting plenty of calories from your own body fat. So it's a wonderful way to lose weight because you can do it. You feel good during the program because you're eating lean protein, plenty of vegetables, fruit. So really eating the foods we're supposed to eat, right? Not the processed, sugar-filled foods we eat normally. So it's a great way to lose weight. And so let's talk to Mary Kay, and welcome, and
thank you.
Thanks for being here. So what brought you into Renew originally in the first place?
Well, I had been thinking I needed to do something for a very long time. And then I saw a friend of mine who actually works here. And she had told me about what she had done. And I was like, oh, okay. So I said, oh, okay, well, I think I'll do that. Not really sure that I was going to, but she did call me again, and I went ahead and signed up and was a little leery, or, you know, I didn't know what I was getting into. And so came in, the staff is phenomenal. Everybody is so friendly and nice. And I figured I'd probably better lose something. I had to either lose or die. So yeah, I mean, that was basically it. I couldn't roll over in bed without, I couldn't breathe after I rolled over.
Wow.
I couldn't hardly get to the bathroom without not breathing. So
Right.
I had to do something.
And she's talking about her friend is Marion, who is our wonderful nurse practitioner. And Marion herself has lost an incredible amount of weight.
Correct.
I want to say 100 pounds or more, and it looks amazing. Her health is so much better, and that's what she really wanted for Mary Kay. Marion told me about your story and
Right.
said you've got to talk to her. So you came in, if you don't mind sharing, what did you weigh when you came in to see us?
430 pounds.
430, okay. And what do you weigh now? And I also want to mention, she's still in her weight loss journey. She's got a bigger goal than this, but what is your current weight?
It was 342.
Wow, that's wonderful. So she's lost over 80 pounds, 85.
Yeah, 85
pounds.
pounds.
Yeah.
Mhm.
And she's going to continue to lose weight. So you've done, you said to 2 rounds, correct?
Correct, I've done 2.
Okay.
My goal, when they asked me in the beginning how much did I want to lose, I said 200, but that was just that was a number I just threw out there, but I still want more than that. But if I can get the 200, I'll be very happy, I think.
Absolutely. And we were talking earlier, and one of the things a lot of people, she's had friends that have done other programs,
Correct.
lost weight, and then gained it back, right? Plus. And so here at Renew, the reason that Clean Start is, so popular is that you learn how to eat. It's
Correct.
not just about losing weight. We're not using a stimulant to stop your appetite. We're
Right.
not using anything that's not natural.
Right.
And so you learn how much to eat and what foods to eat to lose weight and then to keep it off and maintain. So now, I guess you were telling me, instead of, we were talking about snacks, and I was telling her how my guy likes to eat popcorn and chips, and I try to find something healthy. And you were saying, what do you have on your counter now for your snack?
Apples, oranges, grapefruit.
Right.
Celery in the fridge, you
Sure.
know. It's all kinds of salad stuff.
Mm-hmm.
Yeah, my buying habits have definitely changed,
Right.
My shopping has definitely changed, which is great.
Mhm.
I mean, I feel better about it anyway.
Absolutely. And one of the things you've noticed is an improvement in your health. Is that correct?
Oh, definitely. I can walk now.
Mhm.
I can hold my grandbabies,
Aw.
you know, without falling over.
Right.
Yeah. So, I mean, yeah, I can breathe. That's-
Right. And something about the steering wheel. What did Marion tell me about your car? She's funny.
Oh my gosh, I forgot about it actually. Well, I can sit behind my steering wheel and my belly doesn't hang over the steering wheel.
Wow.
I also found out I had an extender on my seatbelt,
Mhm.
which I don't need anymore.
Oh,
So,
wonderful. That's wonderful.
yeah.
So, you know, inspirational because no matter where you start, you know, you may only have 30 pounds to lose or you may have 200 pounds to lose, you know, but wherever you start, do it. Because, I mean, 85 pounds down, over 85 pounds down, and we're going to have her back with us. Hopefully, we'll wait until maybe the December or next spring open house.
Okay.
But we're going to have her back and want to follow her journey because it's very inspirational. And I'm so thankful that you were willing to come on and share.
Well, I thank y'all for helping me live. But yeah, because I started October the 1st. That was my start date for this. And
That's
I-
fast. Wow.
That was
So
my
it hasn't even been 6
first-
months, right? Or it's about right at 6 months.
Right.
Wow.
Well, let's see. November, December, January, March. Oh, 5.
5 months. 85 pounds, 5 months.
Yeah.
That's amazing.
Yeah.
That's
Yeah.
amazing. Yeah, so we'll
great.
definitely have you back. And you know, through this process, is there anything you want to share with anyone out there about anything you've learned through the program?
My biggest thing is if you feel hesitant, jump that hurdle and go ahead and come on in. You'll live longer and you'll feel better, and you know you can do more. I'm really happy. I figured I retired and now I want to be able to do stuff, and I wasn't able to do anything really
Right,
before. So
right,
do it. If you're thinking about it, just do it. Yeah.
exactly. That's a good. Do it.
Do it.
All right. Well, we'll see you again in a future video, and I appreciate your coming in and sharing today.
Thank you. Thank
Okay.
you guys all.
Welcome back. So Mary Kay, what an inspiration. So happy she was willing to share with us, and so encouraging for anybody who's thinking they're past the point of no return.
Right.
There is no point of no return.
No.
Okay. This
And I
is-
love her long-term mindset.
Oh,
Like,
yes.
you know, she's not looking at this like a quick fix. She's putting in the time, effort, and we're here to support her along the way.
Absolutely. She is. And we're going to revisit in a few months and talk to her again and follow her journey. But to anybody who's considering, you know, something dramatic like surgery, bariatric surgery, or something like that, I would encourage you first to do it more naturally, right? To learn how to eat,
And
to
make that lifestyle change.
lifestyle change. And we've seen it over and over. We have lots of clients who've lost hundreds of pounds here. And so I just would encourage you to call and again, get started, and don't be afraid to come in. I also want to let you know, we have a great special tonight for
What is it?
our Clean Start weight loss.
I'm
It's
excited too.
$300 off a full round of our Clean Start weight loss. So
Wonderful.
it's a great time, and summer's coming, and
It's
you
the
know,
perfect time to be doing clean.
you
start.
know what's coming, shorts and swimsuits,
That's right.
right? So it's time to, you know, lose some weight and be your best self for summer. And not only do we have a special, but we have a giveaway.
Ooh,
Our-
is this the part?
It is.
Yes, my
Jamie's
favorite.
favorite part. I'm gonna let her draw. Someone's gonna win a full round.
Let's see, who is it?
Who is it?
Cindy Chirinos.
Cindy. Yay. Congratulations. So you just won a full round of Clean Start weight loss. just give us a call tonight and we're going to put it on your chart. And so it'll be waiting for you.
That's
But,
right.
go ahead and give us a call tonight. We'll get you scheduled. And we're so happy that you won. Congratulations to Cindy.
That's right.
All
And if
right.
it's not your thing, then you'll be able to use it towards something, you put the value toward another service.
That's correct.
Love
Yep,
it.
Yep, absolutely. All right. So you know what? Let's see what's coming up next.
It's my lucky day. It's my lucky day.
Okay, can you put the lens
It's my
on there?
lucky day. My lucky day.
I am so excited because I have a special guest today. This is Hannah from our Fredericksburg location, Renew Health and Wellness in Fredericksburg. And she is going to join me today to talk about something that we love, and that would be fat reduction. So we have great devices at our locations that do a myriad of things. So Hannah, what do you think about the device at your location?
So I love our body contouring treatments. They work on those hard to treat places like the abdomen, arms, the love handles, the back of the thighs, the front of the thighs, to help with that, body contouring in those hard to target areas that really don't do anything.
Yeah.
You're just doing diet and exercise, which you need.
Right.
But you really need that extra push to get you to where you need to be with that.
Sure. So as we get older, especially, you can work out and you can eat healthy, and you may be at your ideal weight, but you still go, what is this little pooch, or what is going on with the love handles, and why is my arm, flappy? So that's the kind of things this treats, and what we love about it is that it's not painful at all.
No downtime.
And there's no downtime. It's not surgery. So you don't have to worry about scarring. It's just a safe and effective way to reduce fat. Also, I do want to mention it uses radio frequency. So that heats that underlying fat and reduces it. And it's like shrinking.
And it's effective, it's safe, it
Right.
just heats that area to a certain therapeutic temperature to get it to kind of break down. And
Break down the fat.
that's right.
So who would not be a good candidate for this, Hannah?
Someone with unrealistic expectations. So you want to have realistic expectations. It is for those areas that are harder to target. You've worked out and you just have that extra bit that you just want to kind of work on that volume reduction, so it makes a big difference for that. So you always will meet with our medical professional, and they will definitely look at your medical history to make sure you're a good candidate, because your safety is our number one concern. But we want you to have the best results, and these treatments will do that for you.
Exactly. I mean, you can do a ton of sit-ups, but sometimes that little pudge just won't budge. So this device is
I like that.
Thank you.
Trish. The pudge that won't budge.
came up with that out of the blue.
I love it. That's going to be our new.
Yeah, that's right. We'll put that on a poster.
Yes.
So seriously, if you have any pockets of fat or you want to reduce in any area, it does bellies, as she mentioned, and thighs, and all those places that tend to resist reduction, then this body contouring device is going to work for you. So our consults are free. I'm happy to look at the area as well and let you know if you're a good candidate for it. And there's no downtime with this, no pain, as we mentioned. So if you have an area you're not pleased about, and summer's coming, Hannah.
Yes. You just have to be extremely hydrated when you come in for these treatments. So that's going to be
true.
the one thing to remember, is to be extremely hydrated before you come in for your body contouring treatments.
That's right. And during and after. Drink a lot of water. But that's all your homework, really. The device does all the rest of the work. So yes, give us a call, and we'll get you in. We can, and this is relatively fast. So how many treatments do people need?
I would say typically it's anywhere from 5 to 8 treatments, and the treatments take about 30 minutes. So depending on the area that you're treating, it could take a little longer, but they're Pretty quick.
Pretty
You can do it on your
quick.
lunchtime and get back to work.
And how often do you come in?
It really depends on the area too. It's usually anywhere from 1 to 2 weeks apart for
Okay.
treatment.
So you still have time before
You do.
you want to put that swimsuit on. Come in here and get that body in tip-top shape. Well, thank you for coming in today,
For
Hannah.
having me.
You're welcome.
We look forward to seeing you guys come in for your free consultations.
Yes, we do. So, summer's on the way. You saw the video. And I'm telling you, you can work out and you can eat clean and you can still have stubborn areas
Oh,
of
you
fat.
can. That cellulite, that,
Yes.
well, yeah, that dimpling is just, yep.
Woo. So,
Body contouring is a blessing.
it is. So if you have an area and you're like, oh gosh, this is bothering me, well, call us because I'm telling you, this great technology works great. So body contouring is where it's at for
And
those
what-
stubborn areas.
In particular, the ones that we use, some people are familiar with cool sculpting, right? But
Right.
those body contouring ones that are using the cool sculpting can often, they can leave ridges
They
on
do.
people.
Mhm.
Whereas ours is using like heat that disperses more evenly and disperses outward, and we don't end up with that problem. It's still causing cell apoptosis, which is just the medical word for like causing cell death. And you want those fat cells to die and then let your body, drink plenty of water
Right.
and then.
Lots of water.
Mhm.
Yes. So we don't want the ridges. We want it to be smooth and definitely we want to get rid of the fat. So all the locations have, they're not all the same devices, but they all work in the same way as far as
Mhm.
radio frequency and getting rid of that, the
An
fat.
effective way to,
Mhm.
yep. Contour.
Absolutely.
Mhm.
So we have a great special tonight. We are offering $500 off our body contouring packages tonight. So it is a great time
Trish,
to,
how many are in a package?
so it depends on the device and the area treated,
Oh,
but
okay.
typically I believe it's going to be somewhere between 5 and 7.
Okay.
Yep. And so call us. But you know what we have to do first, Jamie? We have to give
Drum
one away.
roll.
Yay, our favorite thing. Let's
Let's
see who
see.
wins
Stir it
a
up.
body contouring
Body
package.
contour goes to Penny Gregory.
Penny,
Yay, I love the name.
congratulations. Yay. Wow. Okay. Well, Penny, give us a call tonight. We're going to put this on your chart, but we're super excited for you to
Great
come in
timing
and
too. Spring is
yes.
the perfect time for some body contour.
Definitely. Definitely. Summer's on the way. All right. So you know what? Let's move on to the next service and find out what's coming up.
Lisa, yes.
Tell her yes.
Lisa, yes.
It's my lucky day. It's my lucky day. It's my lucky day. My lucky day.
Get summer ready. Get excited. It's all about
Forever
aesthetics.
young. Forever young. Forever young.
One of the most common treatments we do here at Renew is laser hair removal.
I do mostly laser hair removal, especially for the face. A lot of people have a little bit of a mustache or chin hair.
The most common areas that are treated are the mustache, the chin area, and the neck.
But a lot of other areas, legs, underarms, bikini areas, full arms.
But there is also multiple areas that you can get treated. It just depends on the patient and what they specifically want.
Some of the hair you can disable, but not all of it. So you do have to come back for multiple treatments. And especially with those people who do have other things going on, like PCOS, a condition where women have cysts on their ovaries and it can stimulate hair growth.
It's a series of 6 to 8 treatments typically, and what it does is it targets the hair follicle and it kills it so that it doesn't grow again.
I had a client who had almost a full beard under here. She's female. When she first came in, she was hair long, covering it, just because she was embarrassed. Even if you shaved, you can still kind of see unless you're wearing a lot of makeup. And then I would say by the 4th treatment, she got a haircut. And she was, here I am. So it was great to watch the confidence.
It's been such a dramatic change as far as their boost of confidence.
Microneedling basically is a procedure that pushes little holes in your skin, very microscopic holes. And then in that way it kind of damages the skin a little bit, and it stimulates collagen production.
Specific lines, either the lines between the eyes, the forehead, the smile lines, and they want to soften those or completely have them go away.
It's great for texture and fine lines and wrinkles, some pigment issues.
Sometimes I have some patients that want to go a more natural way. They don't want to try the neurotoxins or the fillers. We create micro trauma with this laser or with the microneedling, or both.
We also do it with what we call PRP, which is a platelet-rich plasma, and I put that on during the treatment as well as after the treatment. It gives it a little bit of a boost as far as rejuvenation is concerned.
It makes it so that your own body sends the healing agents to the area to produce that collagen again, which in turn helps with the fine lines. It helps with getting that bounciness back in our skin that we used to have when we were younger. It also helps with scarring. So if we have any acne scars, it also helps to smooth those out.
Plasma is from your own blood, and we have you come in and the medical assistants will draw your blood, they'll spin it, and it separates from the red blood cells and the platelets, and we just take the platelets out. It's clear in color, so I have a lot of people that think that they're gonna come out with blood on their face and go home, but it's not. It's clear and a little shiny.
I typically recommend it to everybody. I think that everyone should do it at least once a year because it's always good to do different treatments to stimulate your own skin to rejuvenate itself.
Helping them with their confidence, things that they look at themselves and don't like, and I like to give them solutions to that. I think it's freeing for them, so that's what excites me.
The overall change, not just physically, but also emotionally, the self-esteem boost, it's huge, what I've seen from a lot of my patients.
You are going to get the results faster than if you use, say, a cream or something over the counter.
Just so you know, you're in good hands.
Forever young.
Oops. Sorry about that. We just got caught not being ready. But look who's with us. It's Sabrina. So Sabrina is a PA. Here she works in Richmond and in Fredericksburg, and she is an expert on our fillers and Botox. So she does both of those. She also is going to talk tonight a little bit about skin tightening.
That's right.
Which is so needed.
It is much needed.
Yes.
So I will tell you, I had been waiting forever to finally get our Viora. Because I have so many patients that have been waiting to get this skin tightening, mostly for the neck area. I mean, it treats all areas, but I've just been obsessed with this machine. It's amazing, guys. It's so amazing.
Right. So it can tighten anywhere, right?
Anywhere. We can
Yes.
do the neck, we can do the eyelids, you can do even, the whole face. It's the abdomen. It treats everything. I tell you, this machine, I've been waiting for it.
Right.
I have been waiting for it.
Yes. So if you have some loose skin, you can definitely get tighter. I mean, we all deal as we age, everything kind of gets loose and starts to, get, I don't know. Either you're going to end up feeling like you have extra fat here and the extra skin, or some people just have the loose skin, the jowls, this is the answer, the
Yes,
Viora.
Absolutely.
And that is in Fredericksburg, Greenville, Nashville have Viora. Richmond, we have the Morpheus 8, which uses microneedling with radio frequency for skin tightening. So it works a little bit differently than the Viora. Both were radio frequency.
Yeah, they're both radio frequency. They both cause the same effect. So you create a little bit of micro trauma to the area.
both of them penetrate to the deeper layers, which causes that microtrauma to get the fibroblasts in the area, ultimately giving you the collagen stimulation. I tell this to a lot of my patients that when we turn 28, we stop producing collagen. So we need something to help us produce that again. And this is something that has become so, I would say, so common to do, like microneedling treatments, skin tightening treatments, get your own body to naturally create that collagen and do that for you.
Right. And I'm in my 60s and I do definitely think of this as maintenance. Okay. I don't want to have plastic surgery. Well, maybe someday, but I'm putting it off as long as possible. So for me, doing maintenance, whether it's microneedling, or it's radio frequency with microneedling, or, anything that is going to, help me delay that kind of invasive surgery, I'm going to do. And I encourage our clients a lot. I say, you know what? This is like your car. You're taking care. You change your oil. If you get rock chips, you get those, fixed. So you take care of your car. You're worth more than your car. So take care of yourself, right?
Absolutely.
You keep everything together if you can. So I want to show you some pictures here. So we didn't talk about microneedling too much. We also have just flat out microneedling. And it can do amazing things. And we have some before and afters of you, Sabrina. So, we're going to show those just to show you what it can do. So, what you're dealing with a lot of things there, some sun damage.
So yes, actually, like the biggest thing I was looking for with my microneedling, and this one was done with PRP. So what the difference between doing microneedling by itself and then doing it with PRP is that PRP just gives it an extra boost, like I would say like 100 times boost to what you can get out of the microneedling. Now, as far as what it can do for you, for me specifically, I was looking for my pores to kind of shrink a little bit more. I was looking for some of that fine line reduction, and I was looking for a little bit more elasticity back into my skin. When I was looking at my befores and afters, I knew my skin looked better. I did have a lot of my patients ask me, have you done something different? Your skin looks really good. You haven't been wearing makeup and you still look amazing. And I'm like, wow, I really feel really confident after this. And when we started to look at pictures, and this actually came up with one of my patients specifically, that I was like, hey, look at my pores. They're so much better now. And then my patient specifically was the one that was like, your tone is different too. Like my pigmentation, the skin pigmentation, I have a lot of freckles. It was a complete, like a 180. It just looked so much more clear. It looked so much more beautiful. And so for me, that was shocking that even my patient noticed, and I didn't even pick up on that because I was so focused in what I wanted to change from getting the microneedling treatment that I didn't even realize that the whole picture, it changes everything.
Right. Absolutely. And I love it too. I do them several a year. I think they're amazing. So it's a great procedure, and we have a great special. We have 30% off tonight. So please pick up the phone and give us a call. And in the video that with Sabrina, she talked about hair reduction, right? Laser hair reduction, which is in many cases, I mean, I've done my whole body and really I don't have to shave many places anymore, right?
Yes.
Because it's a great, you can do a major reduction in hair. And with summer coming, we're also offering that for 30% off. So so give us a call and, get your skin ready, get rid of the unwanted hair. It's a great time to take advantage of that tonight. Yes. We also, we have Sabrina. I want to tell you, she is our expert Botox and filler girl. And so she's a great injector. And so we want to talk a little bit about Botox and fillers and show some pictures about what it can do for you. A lot of clients are afraid of it. They come in and they're like, I don't know. I don't want to look like someone different. I'm afraid. I've seen those movie stars and they don't even look like themselves anymore. And I say, if you have a good injector, what they're trying to do is take you back in time.
Mhm.
They're not trying to make you into someone else. So Sabrina is excellent at that. And so if
thank
you
you.
look on the screen now, you can see, tell us about this client, Sabrina.
So this is one of my girls. I will tell you, the only thing that we have been doing is making sure that she has a good skincare routine, and then we've been doing Botox and just maintaining with Botox. And as
Wow.
you can see, even with just Botox, you see that her skin looks just so much more refreshed. It looks good. Now, for this next picture that you're showing, this is a different picture, a different patient.
Yes.
This patient specifically was actually looking for, as we get older, we lose a little bit of that volume in our lips, and that does make us look a little bit more aged. And so she really wanted something that was very natural and something that wasn't going to be, you see a lot of those people out there that just walk around. It just looks very unnatural. And I said to her, it takes a good injector, and also it takes a lot of, it takes a lot of product to actually not get you to look natural. And it also takes a good injector to make sure that your process goes the right way and you get the good results. Like this patient specifically, I told her, we can always tailor exactly what you're trying to achieve out of this treatment. And luckily, I will say luckily, a lot of my patients do choose the natural look. And that's actually my goal for all my patients, to naturally enhance those features again and get them back to looking how they used to look.
Absolutely. And I will tell you, she does an incredible job, and it's really taking you it's just taking you back in time to what you look like when you were younger, which is what we all want. Right? So we have a great special tonight. We have a discount on our Botox down to $10.50 a unit.
Oh.
And we have a discount on Xeomin, another, I don't know, I never say it right.
Neurotoxin. It's
Thank
a
you.
neurotoxin.
Neurotoxin.
They both do the same exact thing. The molecule's just slightly different.
Right. So it's $9.50 a unit. And so if you've been thinking, I want to get rid of my wrinkles, now's the time. Tonight is the night. So give us a call with that. And then also we have a giveaway. Yay. We have a giveaway.
This is a surprise to me too, guys, just so you know.
We have a giveaway. I'm going to let Sabrina draw it.
Yay.
This is for 30 units of Botox.
Right.
Okay. Who's going to win?
All right. Botox or filler winner. Julia Dodd.
Julia. Yay. Congratulations, Julia. 30 units of Botox. So give us a call and we will put it on you, and then you can come in and get scheduled for your free Botox and be wrinkle free. Congratulations.
I got you, girl.
Wonderful. All right. So I know we're going to wrap it up soon. We have one final video. So we're going to meet Amanda.
Oh, yay.
Hi everyone, I'm Amanda. I'm a nurse practitioner at Renew Health and Wellness. Today we're going to be talking about a couple of our treatments that uses our IPL, which is intense pulse light therapy. Pigment is our body's natural way to protect ourselves from sun damage. So if you've been out in the sun a lot with no sunscreen, you probably have a couple pigmented lesions. Pigmented lesions are when your body produces melanin in the skin and it darkens areas in your skin. A couple examples would be like the sunspots, freckles, or even sometimes when you've just damaged your skin from acne, popping pimples. That injury, that damage to your skin makes your body produce the melanin in your skin to cause that hyperpigmentation. So melanin is just our way that our body protects ourselves from light, and also you can also get it through genetics and other environmental triggers. The light targets the melanin in the skin, and the goal is to heat up that melanin and the surrounding cells that produce the melanin, and so the pigment shatters. And then your body gets rid of that pigment through phagocytosis and also by crusting. So that just means like your cell picks up the debris from the shattered pigment and just either reabsorbs it or kicks it out of your body. Benefits of this treatment: even skin tone, texture, improved confidence, and just overall satisfaction with your personal aesthetics. Our vascular system is made up of a complex network of vessels. And anytime there's an abnormality within those vessels, we get vascular lesions. Some examples like rosacea, the little red veins right around the nose. And so for the first two, the light sensitive molecules it's targeting is the melanin. And then for the vascular lesions, the light sensitive molecule that is targeting is the hemoglobin. And so the goal for the vascular lesion treatment is for the hemoglobin to absorb enough light to heat up to clot. When it coagulates, then our body gets rid of it through phagocytosis, which is when our body cells either reabsorbs it or kicks it out the body. And then the venule wall hardens, does not retain that blood circulation through it. And then again, your body will slowly break that down and then it'll disappear over time. It's discoloration, but it does also target small veins as well. It's found around the nose, and as we age, we see like those little red veins. That's what this treatment would be really best to target, or little small vessels on the side of your face that you developed over time that you're like, I just don't really like that look.
Welcome back. And you know what? I want to tell you, I'm older. And I have both of those issues, right? I have sun damage.
Oh,
So discolorization, I have the spots, the sunspots or whatever you want to call them. I have the vessels,
Yep.
the
Those
broken
broken
little
capillaries.
tiny
Yeah.
vessels. I have it all. And at all locations, we can fix it. So if you don't like what you're seeing,
I have rosacea, and I mean, I don't
works for that
right.
as well.
Mhm.
Absolutely. So if this is something you're dealing with, tonight's the night, right? And I'll tell you why, 30% off
Can't
on
beat
this.
that. You cannot beat
And
that.
that is going to be, that's up to $800 off in savings. And you're not going to find that the rest of this year. So now's the time. If you have issues with sun damage, the vessels, give us a call. Let us get you on the schedule, get you in, and we will take care of that for you. So guess what? We're kind of wrapping it up here. And we thank you so much for being with us tonight. But we want to talk a little bit about some things we didn't touch on.
Okay.
We didn't touch on hair restoration.
Oh, the PRP, another place to use it.
Another place, to use PRP, platelet-rich plasma, is in the scalp. Here we do hair restoration with that.
Yep.
So that is also going to be on special tonight. And we also have the VI peel, which is a chemical peel. So
Huge
that
fan.
we love them.
Yep.
So if you see our faces falling off certain times, we did the VI peel.
That's
Great
true.
for skin texture, for sun damage, all of that. That's on special as
And
well.
I love to go back and forth with the VI peel and then some Exceed microneedle.
Oh yeah,
In kind of
microneedling
like
and a
flip
peel.
one this month, one the next month.
Yes.
And you do that, and
we all have it. We have different names for this, but it's the same thing. It's a
Oh.
peel and microneedling in all locations. An incredible combination
Yep.
to really rejuvenate the skin.
Mhm.
Yep, amazing. So we want to end tonight. So those, as I mentioned, it's up to $500 off on those. Okay, so now's the
Fabulous.
time and to call. And when you call, they're going to tell you. They're going to look it up and give you exact numbers tonight. Let's just end this here with circling back to our core service, which is our grand prize giveaway, which we're about to give away, but that's hormones, right?
Right.
Bioidentical natural hormone replacement therapy. So for me, I've been on it for 11 years. I'll be on it forever.
yeah, 100%.
It's going to protect me. But the main thing that I find with it is a great quality of life. I'm in my 60s. I have a great intimate relationship. I have great energy. I have motivation. My brain works
Right.
sometimes.
I'm only receiving 2 out of the 3 of the hormones. And I'm not quite to the estrogen phase yet, but
Right.
the testosterone and progesterone
Yeah,
help in so many ways.
absolutely. So she's in peri and I'm in post.
perimenopause. Yeah,
Right.
That's exactly.
Yeah, but it works. It's so life-changing. So we just encourage you, if you've been nervous about it or you just want to know more about it, just call
Come
us.
talk with us about
Yeah,
it.
come
Because
on
truth
in.
be told, you're talking about the symptoms, but me, healthcare provider mindset, I'm like bone health, brain health, heart
Yes.
protection. Like I'm
Yes.
just in the back of my
Yes.
mind, Even if I didn't have hot flashes and night sweats coming down the road, I'd be like, no, I like my bones. I like my heart. I'm going to protect it.
Absolutely. You got this one life. That's it. Right. So
let's make it a good, long, healthy one.
absolutely. That's exactly right. So you know what we're going to do now, Jamie? We're going to give away a full year of hormone therapy, bioidentical hormone therapy.
This is where I really wish I had the drum roll. All right. Okay, let's see. Let's see who we've got here. I'm stirring it around. I'm going to the very bottom.
Oh boy.
And we have Cynthia Parker.
Oh, Cynthia Parker.
Yay!
Yay. So give us a call, Cynthia, and we will, we're going to
Get
put
you
this
set
on
up.
get you set up. We're very excited for you. And you know what? We're so grateful that you all joined us tonight. We really appreciate it. And we want to say thank you to our beloved Renew family clients who are with us tonight. And we want to encourage you all to any questions, even if you just have questions, give us a call, right? We're here. We're gonna stay here for the next, I don't know,
until the phone
hour.
stops ringing.
Who knows, 2
And so
hours.
if you missed, like if you called earlier and you got a voicemail, a weird voicemail when we were having our technical difficulties, just give us a call back. We're ready to chat and look forward to hearing from you.
Absolutely. And the specials are going to be on the screen here in a second. So you can read through them and, decide. And if you don't know what you want, call us because we'll talk about it with you. And even if you don't know, call and schedule a consultation.
Right.
And then we'll one-on-one.
No harm in gathering information.
Exactly. Absolutely. And once again, we want to thank you so much for being with us
and
tonight.
for taking the time out of your evening. We appreciate it.
Absolutely. All right. Thanks, everybody.